We're here today because too many New Jerseyans have struggled with opioid addiction. Too many mothers and fathers, sisters and brothers, friends and neighbors have been lost. And too many communities across our state and the country continue to struggle with the scourge of addictive prescription painkillers, heroin, and increasingly fentanyl, which can be up to 50 times more potent than heroin. These substances are highly addictive and all too often lethal. In 2016, we saw opioid deaths in New Jersey reach an all-time high with 2,221 lives lost. That's a 40% increase, according to the New Jersey State Attorney General's office. And at least 1,900 of those deaths were due to heroin and fentanyl overdoses. New Jersey ranks 6th in the nation for the highest rate of visits to the emergency room due to opioid abuse or overdose. The bottom line is this epidemic doesn't discriminate by age or color or gender or socioeconomic status. In fact, it's hard to meet any New Jerseyan who hasn't been touched by this crisis in some way. For years now, I have been fighting an uphill battle in Washington to ramp up the federal response to America's opioid epidemic and better support the work of organizations here in New Jersey on the front lines of this crisis. As Pamela mentioned, in 2016, I helped pass the Comprehensive Addiction and Recovery Act, known as CARA. But I was frustrated that it never received the proper resources necessary to fight an opioid epidemic as severe as ours. That's why, as a result of Democratic leadership, we had a big fight over the budget and whether or not we were going to lift this domestic discretionary spending caps at the same time that we were lifting defense caps. And of course, we're all for the nation's national defense, but we also have to defend our communities at home. And that means having the domestic discretionary funds to be able to do important work in education and healthcare and other similar things. So as a result of standing firm, our initiatives helped pass a 2-year budget agreement last month that includes $6 billion in additional funding specifically for fighting that opioid crisis. That's $6 billion that will go not just to addiction treatment and recovery and mental health care, which are all important, but also relapse prevention, education, and training that help recovering addicts rebuild their lives and stay on track. And you better believe that I'm going to fight as hard as I can to bring much of that funding to New Jersey so that organizations like Prevention Links can save as many lives as they can. At the same time that we are now having this money and then now making sure that it's distributed accordingly, we still have another fight going on. And that's the fight to make sure that the Trump administration cannot achieve in their crusade to give the Affordable Care Act a death by 1,000 cuts. I strongly have opposed the repeal of the law, which would send premiums soaring. It would leave millions without insurance, and it would take away the Medicaid expansion that covered over 500,000 people in New Jersey. And that expansion was just about, yes, it was about health care, but it gave for the first time many people mental health care coverage and addiction treatment coverage that did not exist before. So we're not going to let that happen. In the past year alone, I've heard from too many New Jerseyans who credit programs like Medicaid expansion with giving them access to care, including mental health care, for the very first time. We have to do everything we can to empower professionals like Pamela and her team to do the job and to help people in need. At the Experience, Strength, and Hope Recovery Center, they've shown us the value of a well-coordinated program that takes a comprehensive approach. From preventing, and I'm very big into that proposition to start off with, from preventing youth substance abuse to ensuring families have flexible treatment options to focusing on long-term relapse prevention. And as we do these things, make no mistake, we must get fentanyl off of our streets. But as law enforcement works to crack down on those selling deadly drugs to those struggling with addiction, we know that a deterrent-based approach alone can't turn the tide. So this is an all-hands-on-deck situation. It's about saving lives and giving people hope that they can get better and lead healthy, productive, and fulfilling lives. It's about caring, not punishing those struggling with addiction and mental illness. It's about building on successful programs like those run by Prevention Links so that more New Jerseyans can prevent in the first place getting addicted. Moving the industry, the pharmaceutical industry, and moving our hospitals to think about different ways for pain management so we don't get people addicted to an opioid-based drug in the first place, and to help those who are addicted break free of addiction.